Hi, Dr. Robin Sykes here, Facebook Live at Jupiter Plastic Surgery Center. And today we have special guests, two special guests, one and also a visitor. And Alicia was with the company Prolenium that makes Revenus Versa. That's one of the things we're going to talk about today. And TC is one of our friends that she's actually been a patient for a number of years. And she can give us some insights into kind of what it's like to do surgery here and fillers and things like that. So I think without any further ado, since we have Alicia here to talk about the product Versa, that's going to be one of our first things to talk about. So go ahead, Alicia, why don't you just tell a little bit about what this product is. Then we'll talk about how we use it and give some before and after pictures.
Revenus Versa is a hyaluronic acid. It's a 1.2 cc vial. We initially came out with Revenus Versa with lidocaine, which is, and I'll read it right from our book here, used to treat moderate to severe facial wrinkles and folds, including nasolabial folds in patients 22 years of age and older. And now we have the beautiful Revenus lips, same product, different packaging, for submucosal implantation into the lip for patients 22 years of age and older. The beautiful thing about this product is, number one, it's a 1.2 cc vial, and our unique manufacturing process. It's a hyaluronic acid. However, we go through a very, very lengthy process in order to make sure that the product is wet milled, thereby creating hyaluronic acid spheres that mimic that of your own body, as well as a 7-day dialysis to remove any endotoxin. The FDA allows any hyaluronic acid to leave a facility with 5%. We don't allow it to leave the facility with more than 0.05% endotoxin. We have a very clean product that gives you 20% more per vial, and we have not had one report of a late onset granuloma since our launch, and it's an incredible product.
It's been around, what, a couple of years now?
Yes, we came to the United States in 2017, and we've had millions of vials sold to hundreds of thousands of patients all over the country.
So it's one of my favorite, there's all these different fillers that we talk about all the time. They're all slightly different. They have different things that I like to use them for. This is one of the products I really like to use in the lips. And I think one of the reasons I like it the most is all the time I've been using it here in the office, which is probably 2.5 to 3 years, the longevity in the lips. I think that's one of the things that we're going to have TC speak about. And why does it do that? Is that just because of how it's made? I really notice it longer than most other products in the lips myself.
It's hard for me to speak to that. However, I know our manufacturing process definitely makes it such a pure, unique product. Mm-hmm. So our efficacy is fantastic.
So it's really nice. And the other thing that's really nice about it is bruising. So because I don't see a lot of bruising when I'm putting it in. I usually put things in very slowly in the lips anyway. But okay, so that leads me to my picture here. So we had TC coming in last week to do the injections, so we wouldn't have to do them on air. But I wanted to kind of show you the before and the after. And I don't know if you can focus on that, but this is the before and this is the after. And we put it in more than one place. We put it in her lips, but we also put it around the mouth a little bit. And you can see that, the little tiny injection ports where I actually placed the needle, and the improvement that she got in those areas that were not on the lips. So you can actually use it in other areas in a similar fashion. And I don't know if you can see this one here, but kind of shows where I used it on, which is around the mouth and a little bit down here.
Mm-hmm.
So let's talk about what happened then. So it was like a week ago. Was it Friday?
Yeah, it was just about a week ago. I like to wear makeup. I always have makeup on, especially lipstick. My lipstick was bleeding up towards my nose. I had some areas that were not very smooth. And we had tried this product probably a year ago. My body has a tendency to absorb things like Botox or Dysport very quickly, and they don't last as long on me as something else would. Dr. Sykes tried this particular product that we're talking about on me a year ago. I still had a little bit left. We put it in. Immediately, I saw the difference. Very little bruising. They do a very good topical number, so you feel very, very little and within 2 days, the difference was amazing.
Mm-hmm.
And I've been coming in Dr. Sykes for about 20 years now for a whole lot of different things. Some were more medical than others, but this product is absolutely amazing, and I expect it to be very long lasting.
Okay, great. So, comments, what do you think?
You know, I love your enthusiasm because it is such a great product and we're so excited about it, and it's just proven to be time and time again long lasting, smooth. Somebody said to me yesterday, it's juicy. So I love that term. I think it's just a beautiful product, and it is tried and true, and I really contributed to the company. Perlinium is amazing, and the manufacturing process, which is so unique.
Mm-hmm.
Okay, so our topic is really facelift and fillers, and I wanted to mention a little bit about facelifting. Again, we have a testimonial because we actually did a facelift on you a number of years ago, and I think that's just kind of interesting to kind of see you now. It's really been like 7 years, I think, since we did that.
And that was, we did the lower, and instant results, again, not painful at all. I tend to have very little bruising, and the results and the way you feel afterwards are absolutely amazing. And to me, that's what it's about, feeling very good about yourself. We've done a few things with my eyes a few times. We also kind of did, I guess it would be a brow.
That was the first thing we did, I think, is what you said.
That,
one of the first.
well, we did a little body
work.
we reduced.
Oh my goodness, that's okay. You don't have to tell everything. But I think the key thing is, keeping up is always a good thing, right? Just kind of
Very
keeping
much
up.
so.
And I think that one of the things that we have put filler in TC over the years as well. And I think if you look at people, sometimes you think they have a little too much filler. Sometimes I think it gets overdone. But the fact that we've been putting in for as long as we have, and you're not overdone, I think is a good testament to putting it in what you need, where you need it, not too much. And trying to do something that looks good, enhances your appearance, but doesn't make you look totally different like somebody else, or maybe doesn't go away like you want it to over time. You expect it's going to last a year, maybe a little more if you're lucky, which is nice.
Yeah, everything you've done has been completely natural. It's not like I would walk up and somebody would go, "Oh, you look totally different." No, you look refreshed, you feel refreshed, and I've never ever had any difficulties with any of the products. They've all been amazing.
So fortunately, TC's had a great experience. I can't guarantee everyone's going to have absolutely no pain, so just a little caveat there. But I appreciate you telling me, and I know that a lot of people tell me the same thing. It's good when it happens occasionally. People have a little more problems than others, but I'm just trying to be honest. All right, very good. So, any comments or any questions, Mary?
Yeah, there's a question here about the mini. They want to know how long the recovery is and when do the sutures come out?
Oh, okay, good questions. So, I do the mini lifts here in the outpatient surgery center in this building. And generally I'll see people, the next day we take off the big dressing that we put on, and then recovery takes, it depends on the person, but the incisions are all pretty well hidden. They're, under the sideburn, around the ears, maybe under here. So you don't get a lot of swelling, and you don't have a lot of things to actually recover from in the center of the face. They look pretty good, really, around a week to 10 days. Pretty good. Your stitches usually come out about 5 to 7 days, depending on when we do it. And because it's a mini lift, it's less invasive, less risky to the nerves, more natural. All those reasons is, I think, why it's been such a good procedure for all of our patients.
Okay, and there's another question. How much bruising will there be?
Again, that depends on the person. Yeah. Everyone's different. I mean, I've had young people that bruise a lot. I've had old people that bruise a lot, and it doesn't really make sense, necessarily. We do have you stop for fillers, for example. Stop anything that might make you bruise, like aspirin or garlic, ginseng, ginkgo. There's a whole kind of list of things. The CBD, all of those things. So we want to try vitamin E, fish oil, try to minimize bruising, when we do any of the filler or surgeries. Okay, very good. And so what else can we talk about today? So I don't really have a lot of, I want you to, a lot of other props here to remind me. We do have Sculptra. I want to talk a little bit about Sculptra. This has been, it's not Alicia's product. I think she knows all the products very well though. Known Alicia for a long time too. So Sculptra is a product that works different than other fillers. It's not really a filler per se. It's more of a stimulator. And so it's used, in my practice I use it a lot of times that people have had a facelift. They just need some volume. They need volumizing in their cheeks, where you tend to lose the volume first, usually the cheeks and the nasolabial. And the areas off the lips is not a lip product. And it's put in a series of injections, which we do. It takes about 6 weeks for your body to build your own, basically your own tissue in the areas that we put it. So it's kind of like getting a lift without a lift. So it's called liquid facelift by some. And then usually you come in and do another series, and sometimes a third series, depending on what needs to be done, how much volume that you need. But the nice thing about the Sculptra is it lasts much longer than most fillers. Most fillers are more like a year and a half. Sculptra's going to last 2.5, 3 years, and even then, when people come in for a little touch-up, they haven't gone back to zero, because it's building your own tissue, and that slowly goes away. So I just like to mention that's Sculptra, and that's a good product. And I do have to mention people are using it in the rear ends these days because it also gives you volume there. So a little something for the younger folks. Okay, and then this is our Versa. There's two different Versa boxes. They have the pink one. Pink is the lip one, and we have the black one, which is
Both the lidocaine.
Yeah, the lidocaine. So very nice. And Sue, can you think of any questions that anyone else has said?
Well, yes, a lot of people ask me all the time if they have their lips done, if they're going to look like, I won't say it, a Kardashian. They're afraid they're going to have a duck face. So we always try to explain that, we do everything here very natural. And I personally have had Versa myself, and I like it because it's really very flexible. You don't feel stiff. You don't feel, I've had people call and say, I had lips done and I hated it, and I feel like I have this big lump, I can't get rid of it. We've never, in almost 12 years here, I've never had anybody say that to me. And my personal experience, like I said, I liked the Versa. We did it, and we had a little leftover to do nasolabials, and I thought it was really, really nice and very flexible. So that is my question. A lot of people will call and ask me, am I going to be able to move my mouth?
Right.
So
that's an important thing.
Yeah.
And I think also, the amount that you put in is the result you're going to get. So, most of the time I'm putting in basically one vial because we're doing the edge of the lips, we're doing a little filler on vertical lines, maybe a little in the marionette area. And that's probably the most common amount that I use. If you want more volume, we need more filler. Most of the time I don't do that though, unless you really want that. So you're not going to get super full lips with one syringe of that, ever, pretty much. A lot of people that are older might need a little more because we're doing nasolabials, we're doing a lot of areas that need a little touch up. I don't know if you want to talk about M-Sculpt. Well, we have Alicia here.
Okay.
Oh, our model.
I was fortunate enough to be the model for Dr. Sykes about 2 years ago.
A couple years ago.
And I think it's fantastic. It definitely works. I believe that your lifestyle has to go along with the procedure, that you keep it up as you would anything. Like when you get injections, you want to protect what you inject, but I am a firm believer in the M-Sculpt. I think it works fantastic.
So we're actually talking about the M-Sculpt, I think, next week.
Mm-hmm.
We're going to get a little more detail about that, but the M-Sculpt Neo, and we have both the M-Sculpt and the M-Sculpt Neo capability, is something that stimulates your muscles, like in your stomach, your rear end, your thighs, arms, and it's going to stimulate the muscles to contract 20,000 times in a half an hour. So it's going to give you this incredible workout without having to work out, without having to go to the gym, and just kind of touch up those areas that need to need build up. And at the same time, you're reducing the fat in the same areas. So it's really a fantastic device, and we're going to have some great beginning of the year specials. We're going to be talking about all that next week. Mm-hmm. So that will be our next week's thing.
Is that an apparatus?
Yes, it is. So it's it has the paddles. That's where the energy is delivered. The original machine only did just the M sculpt. The second one, which is the electromagnetic stimulation of the muscle. The newer one also has a heat component that helps to reduce more of the fat and to stimulate the muscle a little more. So that's called the Neo. So basically the paddles put in your stomach. It does this thing for a half an hour. You do 4 sessions of that, and that's over over a month. And then you can come back and do touch-ups, which is nice because it gives you a little more stimulation over time. And one of the specials we're offering is you do 4 and you get a 5th one. Your kind of follow-up treatment will be at no charge. That's one of our specials.
Mm-hmm.
So that's a really great thing that we're doing, and it's really a good thing to get your body in shape, even though we can't really. I know we're going to this in Florida. We're going to the gym. I know we are. I'm glad we are actually. But for those of you who don't want to do that, there are other alternatives. Aside from the fact you can get this kind of exercise in the gym, this really only happens with this machine.
Did you want to mention, Dr. Sykes, that extra little bonus that we love with the RF for the skin? How it tightens?
Yes. So the heat component is what helps you reduce more fat. The amount of fat that is reduced actually is up to 30%, which is actually more than Cool Sculpt reduces in that area. Then it also has a little, because it's warming the skin to a certain level, it's also tightening the skin a little bit. So it's got all those different effects.
Who wouldn't love that, right? Firm it up,
Absolutely.
tighten it up, slim it down, and
See you later.
yep, see you later.
All right,
Uh-huh.
fabulous. So let's see. One more thing I want to mention is the 26th. We're having a Zia Lunch and Learn. This is one of our people's favorite things to come in and
Mhm.
stock up on products. We have our Representative Nicole is going to be with us on Facebook Live again next week and talking about things and answering any questions that you have. And you can come in person if you have the nerve. We don't bite. I've been vaccinated. It's like a dog. I'm not going to get the rabies. But anyway, we'd love to see if you want to come in and ask your questions. And we're giving the usual discounts that we do. Yeah, people that have come to these love these.
Mhm. Love our Zio products.
Any other comments you have, TC? Thank you so much for being here. And
Thank you for
sharing some of
asking
your-
me. Thank you for always. I open the store. I walk in. This is my family.
Aww.
I love it here. I walk in feeling good. I walk out feeling better.
Oh, there you go.
And looking better, right?
Like that. All right.
We like that. Thank you, TC. We love you too.
Welcome. Thank you for having me today.
And thank you, Alicia, for providing your expertise and the products. Oh, I should mention. So for one of our lucky callers, or if you're watching today and you tell us you're there, we're going to have a drawing for a free syringe of Revenus Versa.
Nice.
Versa Face. So please take advantage of that. And I guess we'll see you soon.
Absolutely.
Okay. Give us a call.
Very good.
Thank you.
Bye now.
Bye.
Bye.